Why do RA medication side effects cause so much worry? Living with rheumatoid arthritis means juggling more than just joint pain. It involves managing ongoing health concerns and emotional stress that come with a long-term illness. One of the biggest worries many people face is the side effects of their medications. These concerns are understandable and rooted in real experiences, but understanding why they happen can help ease some of that worry. RA medications like disease-modifying antirheumatic drugs and biologic therapies are vital. They help control inflammation, prevent joint damage, and improve daily life. But, like all medicines, they can cause side effects. Some are mild, like stomach upset or fatigue, and go away quickly. Others might be more serious, such as increased risk of infections or effects on liver or kidney health. Sometimes, medications can even influence mood or mental health, which adds to the concern. The worry about side effects is often higher because RA is a lifelong condition. Patients may need to take these medications for years or even decades. That long-term commitment raises questions about the cumulative risks. Since many RA drugs affect the immune system, patients may feel anxious about their body's defenses being lowered. Also, information from medication leaflets, online sources, or other patients can sometimes sound alarming or confusing, which fuels uncertainty and fear. Living with RA also takes an emotional toll. Chronic pain, fatigue, and physical limitations can cause stress and worry. These feelings can make concerns about medications seem even bigger. Anxiety can sometimes intensify physical symptoms, creating a cycle that impacts both mental and physical health. Studies show that anxiety is common among people with RA, with nearly a quarter to almost half experiencing symptoms. This highlights how important it is to treat not just the physical disease but also the emotional well-being of patients. It's worth noting that some RA medications have been linked to changes in mood or increased anxiety, but the evidence varies. For example, some disease-modifying drugs might be associated with higher rates of depression or anxiety in certain individuals. On the other hand, newer biologic treatments sometimes help reduce depression symptoms by better controlling inflammation. Still, responses differ from person to person, and ongoing research continues to explore these connections. From a medical standpoint, the benefits of RA medications in preventing joint damage and maintaining function usually outweigh the risks of side effects. But that doesn't mean patient worries should be dismissed. Open communication with healthcare providers is key. Patients should feel comfortable sharing their concerns, asking questions about side effects, and reporting any new symptoms right away. Keeping a journal of physical and emotional changes can help identify patterns and guide discussions with the care team. Managing anxiety about medication side effects can also involve practical steps. Using trusted sources for information, participating in self-management programs, and seeking mental health support when needed can make a big difference. Lifestyle choices like gentle exercise, stress reduction techniques, and a balanced diet can boost overall well-being and resilience. In the end, worry about RA medication side effects is common and understandable. It's part of the experience of living with a chronic illness. Addressing these concerns openly and with support helps patients feel more in control. Remember, treatment plans should be personalized, and discussing any fears with healthcare professionals is always the best course. By combining accurate information, emotional support, and good communication, patients and their care teams can work together to manage both the physical and emotional challenges of rheumatoid arthritis.